Hey guys, welcome to my channel, the Palleidoscope. So today we are going to discuss about a very important topic, that is the 5 common eye problems in dogs. Okay, so this is a topic that I was interested in from a long time, and this is a video that I am making from a long time. Over a week I am working on this. I have done a lot of research and also hopefully this will be a very helpful video to all of you. Do watch it till the end and give your feedback in the comment section. I'll be waiting for all of your response. Okay, so let's start with the 5 common eye problems in dogs. We'll be discussing about 5 eye problems that are glaucoma, cataract, then conjunctivitis, cherry eye and dry eye. Okay. So glaucoma, cataract, conjunctivitis, you must have heard because it happens in humans too. Then cherry eye is a very unique thing that is happening in dogs, and dry eye is basically keratoconjunctivitis, sicca. Okay, so first disease or the first problem that we are going to deal with today is canine glaucoma. Now, let's give a brief introduction of this disease. What is canine glaucoma basically? What is canine glaucoma is when the intraocular pressure, that is the pressure inside the eye, is increasing because of the accumulation of the aqueous humor, then it causes this problem. Why can this problem occur? How can the intraocular pressure increase to that level? It can be either due to the problem in drainage of the aqueous humor or excess production of aqueous humor. Okay. So IOP, like intraocular pressure, IOP is a result of a balance between the production and drainage of the aqueous humor. Okay. The frequency of breed predisposed glaucoma is highest in dogs, except for humans and animals it is highest in dogs. What does this mean? It means that glaucoma happening in certain breeds, it is predisposed in certain breeds. So this is most commonly seen in dogs. You will be understanding this better when I'll be talking about the breed susceptibility of canine glaucoma. Okay. Next, intraocular pressure is measured by a device called tonometer. This is used during the diagnosis. Tonometer is the device that is used to measure the intraocular pressure. So this is the normal eye you are seeing in the left side. This is the normal eye, and eye with glaucoma has increased intraocular pressure. What it will do is it will damage the retina and it will damage the optic nerve. Okay. So normal production and drainage. Let's talk about the normal production and drainage of the aqueous humor. So where it is produced in the ciliary process. Then where it is going? It is going to the posterior chamber. Then through the pupil it is going to the anterior chamber. Okay. So after circulating in the anterior chamber and providing the metabolic requirements, it then exits through the iridocorneal angle. What is iridocorneal angle? It is the angle between cornea and the iris. So through the iridocorneal angle it is exiting, and where it is going? It is going to the venous circulation. Another unconventional path. This is the conventional path. The unconventional path is when it diffuses through the iris and the ciliary body or through the vitreous into the suprachoroidal space. From there the fluid drains into the venous circulation. Okay, both the processes are draining ultimately into the venous circulation, but most commonly it is, or the conventional way is through the iridocorneal angle, but sometimes it is also draining through the diffusion through the iris, ciliary body or through vitreous into the suprachoroidal space. Okay, so this unconventional path is taken up this is draining 15% of the fluids in the dogs. In horse it is 33% and in humans it is only 3%. This unconventional path is taken up for drainage only 15% in dogs, 33% in horses and 3% in humans. Now this is the diagram that will make it more clear. So you will see here the ciliary body or ciliary process is making or producing the aqueous humor. It is then going to the posterior chamber. Then through the pupil it is going to the anterior chamber. and finally it is exiting through the iridocorneal angle. Okay, now the trabecular outflow is helped by muscarinic agonists. This is important for the treatment purpose. Okay, what will be helped by which drug or which pharmacologic agent is muscarinic agonists will help in trabecular outflow, prostaglandin agonist will help in uveoscleral outflow, and aqueous humor inflow will be helped by beta blockers, alpha 2AR agonists and CAIs. Okay, so why is an increase in intraocular pressure a problem? So why is it even a problem? It is a problem because the pressure is increasing. It is ultimately giving a pressure to the retina and to the optic nerve. Okay, so the retina and the optic nerve is having a lot of pressure because of this intraocular pressure. What is retina? It is the layer, the innermost layer that is containing the rods and the cones. What are rods and cones? They are converting the image that is formed into the nerve signals that we get in the brain that helps us to interpret what we are seeing. So rods and cones are damaged, the retina is damaged because of the intraocular pressure increase. Apart from that, what is optic nerve? The nerve that runs from the back of the eye to the brain. This is taking those signals to the brain. So if these two are damaged, what will happen? We will not be able to see. Ultimately, blindness. Okay? So this is the problem that is caused by increase in intraocular pressure. So this is the diagram showing the basic anatomy. Okay. Here this is the retina. Okay? That contains the rods and cones. And this is the optic nerve that is going out from here. If intraocular pressure is increasing, the pressure will damage or degenerate the retina and optic nerve. Okay, so this is a diagram that will help you understand the concept better. Say for example, there is a sink, it is clogged, the water is not able to pass. What will happen? It will overflow. Similarly, in our eye, if the exit pathway is blocked, then what will happen? It will not obviously it will not be able to overflow because the eye can't burst at that time. The intraocular pressure will be continuously increasing. Okay, so this is the thing that is happening actually. Hopefully the concept will be clear by now. Okay, so a small request, please do like this video if you are liking the content, and please subscribe to my channel for more such videos because it keeps me motivated and I get to know your feedback through it. Okay, let's move on. Breeds that are more susceptible. I told you in the very first slide that breed predisposition is highest in the dogs. Breeds that are most susceptible are Alaskan Malamute, English Cocker Spaniel, then Poodle, American Cocker Spaniel, Springer Spaniel, Beagle, Shih Tzu, Boston Terrier, Great Dane, Siberian Husky, Greyhound, miniature. Basically the dogs that have smaller nose, brachycephalic dogs are more susceptible here. Okay, so this is a... Okay, next, classification. Classification can be done in one of the two ways as follows. One is on the basis of cause. It can be primary or secondary. What is primary? When it is happening because of some genetic abnormalities in the drainage pathway. What is secondary? When drainage pathway is obstructed or when there is decrease in outflow because of some injury. Like for example, lens luxation is there, uveitis is there, all this will cause secondary glaucoma. Another classification is on the basis of the drainage angle. When the angle is open, in which the case of obstruction is further downstream. Okay, the obstruction is not in the angle but it is further downstream. It is open glaucoma. And another one is closed or narrow glaucoma when the angle itself is closed, so the obstruction is happening. Okay, so here you can see, here the angle is open, this is open angle glaucoma, but here you can see the angle is closed. So how it can, like, the drainage pathway is open here but ultimately downstream it might be closed. Here there must be some problem or obstruction further downstream but not in the angle. Here the angle itself is closed. Okay, so this is the problem here. The closed glaucoma is this, when the angle itself is closed. Next, the clinical sign. Obvious clinical sign is eye pain. How you can understand that? The dog is going to give its paw near the eye. It will partially close the eye because of the intraocular pressure increase. It will not be able to completely close the eye. It will rub at the eye. It may turn away as you touch him or pet the side of the head. If you're going to caress the side of the head, then it will move its head away. All these signs you will be seeing. A watery discharge from the eye may be seen. Lethargy, loss of appetite may be seen, because obviously it is in pain. Whenever there is pain in the dog, then you will be seeing loss of appetite, lethargy, all these things will be there. Obvious physical swelling and bulging of the eyeball. This is a very obvious sign. The white of the sclera, that is this white part, will be seen red. Okay, looks red and engorged with blood, and this is all red in color. The cornea, or the clear part of the eye, may become cloudy or bluish in color. Blindness can occur very quickly unless the increased IOP or intraocular pressure is decreased. So the main clinical sign that you will be seeing is eye pain, then loss of appetite, then the white part will become red, then cloudy or bluish cornea you will be seeing. So these are some of the clinical signs you will be seeing. And if you are not taking it to the vet very quickly or in time, then the intraocular pressure may increase to such heights that it may also cause blindness. Okay, so it is important to look for symptoms of glaucoma in your dog, as the pressure can be extremely painful. Now, treatment. Let's talk about what are the drugs that can be given with obviously your vet's advice. So prostaglandin analogs, as we have seen in the drainage system that I have seen, that I have shown, the drainage system that I have shown, we have told there also prostaglandin analogs are needed. These drugs act by increasing the unconventional outflow. We have talked there. Okay. So latanoprost, travoprost are some of the drugs that may be used. Then carbonic anhydrase inhibitors. Carbonic anhydrase inhibitors is a key. Carbonic anhydrase is a key enzyme in the production of aqueous humor, and therefore its inhibition will result in lower production and decreased IOP. Now, carbonic anhydrase is very essential in the production of aqueous humor. So if you are giving inhibitors, then its production will be decreased. If the glaucoma is caused because of the increase in the production, then this is very helpful. The topical form of drug called dorzolamide, then brinzolamide, is administered twice a day. Then topical myotics. These drugs increase drainage by opening the iridocorneal angle through contraction of the iris and ciliary muscle. The myotic means what? Myotic means who are decreasing the size of the pupil. So what it is doing is basically contracting the iris and ciliary muscle, so it increases the drainage. The most commonly used drug in this category is pilocarpine, 1% to 4% applied 2 to 3 times a day. Then beta blockers can be given. Sympatholytic drugs reduce aqueous production by reducing the blood flow to the ciliary body. A preparation containing timolol can be given. Dorzolamide is commercially available. Okay. Preparation containing both timolol and dorzolamide is available, and it can be given. In emergency, 2 things can be given: osmotic diuretics. These drugs are obviously not for the long-term treatment, but when emergency lowering of IOP is needed, this can be given. Mannitol is administered slowly at 1 to 2 gram per kg over 30 minutes, and water is withheld for 3 to 4 hours. This can also help, and apart from that, surgical treatment is obviously the last step that is to be taken if nothing is going to work. Surgery to increase aqueous humor outflow, usually by implanting drainage tubes in the eye, or to decrease aqueous production through partial destruction of the ciliary body using laser or cryotherapy. So laser or cryotherapy may be used to partially destruct the ciliary body which is producing the aqueous humor. This can be used, or surgical therapy by implanting the drainage tubes in the eye may be done. Next disease that we will be talking about today is canine cataract. Cataract happens mainly in the older age. Okay, so a brief intro. A cataract refers to a cloudiness of the lens of the eye. Okay, so this is a disease when cloudiness in the lens of the eye is happening. Cataract leads to, when there is cloudiness, what will be happening? There will be blurred vision ranging from partial to complete opacity. When the lens becomes cloudy, it can prevent light from passing to the retina, contributing to vision loss. These are some of the types of the cataracts that you will be seeing. This is the mature type. This is the hyper mature type, Morgagnian type. Okay, so mature is this one that is more common, and immature is this. Initially, you will be seeing like this, then it will be going to this stage, mature. Okay. Next, causes and risk factors of cataract. Obviously, old age, as in humans also, it is mostly happening in the old age. So, old age, genetic predisposition is there. Congenital cataracts or being born with cataracts, this is also seen. Secondary to some other diseases like glaucoma, then diabetes mellitus, electric shock, exposure to radiation or toxic substances may be there. Nutritional disorders, hypocalcemia may also cause, when there is very low calcium levels in the blood, then trauma or eye injury, inflammation, all these can cause cataract. Okay, so this is a diagrammatic representation that I've got from canapet.com. So this is diabetes mellitus, then some other diseases like glaucoma, exposure to some radiation or toxic substances, trauma or injury, nutritional disorders. Nutritional disorders may cause hypocalcemia, may also cause. Okay, so dogs that are at higher risk include American Cocker Spaniel, then Boston Terrier, Golden Retriever, it is very common in Golden Retrievers as well, then a miniature Poodle, miniature Schnauzer, and Siberian Husky. Okay, so the clinical signs that you will be seeing is mainly connected with the opacity of the eye. So you will be seeing that the dog is not able to see properly, it is banging its head with objects and all. So these are some of the main clinical signs you will be seeing. In mild cases, there will be no symptoms because obviously it is starting to blur, so there will be no symptoms. Then when there is more than 60% of opacity, then you will be seeing it has difficulty in navigation in dimly lit areas because the cloudiness is happening gradually. So these are the clinical signs you will be seeing in case of cataract. If a dog has diabetes mellitus, they may have increased thirst, increased frequency of urination, then weight loss may be seen, and this ultimately leads to cataract. The clinical signs will be able to see like this in the diabetes mellitus patients. Next, treatment and prevention. How treatment or prevention may be given? Prevention basically comes from the food items that you are giving. For example, to prevent cataract, carrots, kale, pulses, other green and yellow vegetables may be included in the diet. Apart from that, bilberries are some good supplements that can be given in supplement form because they have good antioxidant property that protects the eye tissues. So bilberries are something very good to give to the dogs. Apart from that, vitamin E and vitamin C supplements may be given in the prescribed dose. This is the prevention part. The treatment part is, it is a progressive disorder. It can worsen day by day. So the treatment is of utmost importance. You are seeing it in the initial phase. You do the treatment initially only so that it does not goes into a much more difficult stage to handle. Cataract surgery is the only treatment that is available till now. So cataract surgery is done in those cases. Okay, conjunctivitis. The third disease that we will be discussing is conjunctivitis. That is very common in humans as well, so it happens in your dog as well. So conjunctivitis. A brief introduction. Conjunctivitis is also known as pink eye or red eye, that will be coming across the articles. I've read a lot of articles and I've seen in most articles they are saying pink eye, red eye and all those things. So conjunctivitis is also known as pink eye. And it is common in dogs as it is common in humans. Similarly, it is also very common in dogs as well. It is an itchy inflammation of the tissue that coats the eye and the lining of the eyelids, called the conjunctiva. What is conjunctiva? It is the tissue that coats the eye and the eyelid and the lining of the eyelid. So if there is an inflammation of conjunctiva, it is called conjunctivitis. You can see itis when we are adding in the end, no? When the suffix is itis, it is meaning that there is inflammation of that part. So conjunctivitis is the inflammation of the conjunctiva. Conjunctivitis can happen at any age by itself or because of another eye problem. While just one eye is typically affected, conjunctivitis can spread to both. When it is infectious because of bacterial or viral, it can easily spread to both the eyes. Symptoms will be redness, puffy. Similarly, like in the humans, the things that you are seeing, similar symptoms will be seen in the dogs as well. Redness, puffy eyelids, stringy discharge will be there, always watery eyes, pawing in the eyes, like the paw is, they're rubbing their paws on the eyes, and squinting is there, eyelids are sticking together. So these are the common symptoms of conjunctivitis. Common types, there are basically 3 types of conjunctivitis: infectious and allergic and all that. So let's discuss it in detail. Allergic conjunctivitis. This allergic reaction is often seasonal and not contagious because it is not happening because of some infectious agent like virus or bacteria. It is allergic, so it is not contagious to other dogs. Causes may be dust mites, pollen, mold, dander, cosmetics and perfumes, drugs, etc. The treatments that can be given is cold compresses and artificial tears, NSAIDs, antihistaminics and steroid eye drops. Viral conjunctivitis, it can spread because it is caused by virus, infectious agent. This is caused by a virus, spreads very easily and can take up to 3 weeks to get better. It has symptoms similar to cold, and upper respiratory infection is also seen along with the common symptoms of conjunctivitis. The treatment include cold compresses, artificial tears and steroid eye drops. Bacterial conjunctivitis. This type is also very contagious. Conjunctivitis and contagious is okay. So this type is also very contagious. Causes are Streptococcus and Staphylococcus. Treatments: antibiotic eye drops or ointments. Okay. Now cherry eye, the 4th very important disease. Okay, cherry eye. Introduction. A brief introduction about cherry eye is, what is cherry eye? It is a common term for the prolapse of the 3rd eyelid gland. Many mammals, including the dogs, are having a 3rd gland, you know. What is it doing? It is acting as a protective layer for the eye when they are fighting, and it also contains a special gland that produces a significant portion of the eye's protective tear film. So this is the function of the 3rd eyelid gland, and it is located inside the lower eyelid, also referred to as the nictitating membrane. So the 3rd eyelid is also known as the nictitating membrane, that most of you would be knowing. The nictitating membrane is present below the lower eyelid or inside the lower eyelid. So the 3rd eyelid serves as an additional protective layer when they are fighting, and as a special gland that produces a significant portion of the eye's protective tear film. Okay, so clinical signs. The clinical signs, it is very common, like very easy to understand. A red swollen mass on the lower eyelid near the nose or the muzzle. This is the red swollen mass that you can see. Okay, so it takes its name from the resemblance to cherry. It looks like cherry, reddish in color. So cherry eye is the name given to it. The cherry eye may be large and cover a significant portion of the cornea, or it may be small and appear only periodically. Okay, so it may be large, it may cover the whole eye, or it may be small and it appears only periodically. Why this is important is because it is producing a very significant part of the tear film. So if this gland is damaged, then it will cause huge damage to the eye. So we have to do the surgical treatment or treatment in time. What causes cherry eye? The gland of the third eyelid is normally anchored to the lower rim of the eye by a fibrous attachment. In certain breeds, it is thought that this attachment is weak, which allows the gland to prolapse very easily. So when this attachment allows the gland to prolapse, then you can see the gland here and it looks like a cherry, reddish in color, so it is called cherry eye. Okay, so this is the gland that we are talking about, the third eyelid. When it prolapses like this, it is called the cherry eye. Okay. Breeds that are susceptible are mainly brachycephalic breeds. Cocker Spaniels, Bulldogs, Boston Terriers, Beagles, Bloodhounds, Lhasa Apsos, Shih Tzus, Lhasa Apsos, all these are brachycephalic dogs with squished faces and short limbs. You know, this is the characteristic of brachycephalic breeds. So, next, treatment. Treatment involves surgical replacement of the third eyelid gland. Okay. It is important to treat the condition as soon as possible. Why it is important? As I already told, it may cause permanent damage to the eye or third eyelid gland. How? Because it is critical and produces up to 50% of the watery portion of the tear film. And if it is not producing, what will happen? Dry eye will be happening. So this is very important for the normal eye and normal functioning of the eye. Hopefully this is clear to all of you. What is happening is we are doing surgical replacement for this. Apart from that, no drug is going to affect properly to cure this. And then why is it important? Because it will otherwise cause permanent damage to the eye or the third eyelid gland. Why is that gland important? That is important because 50% of the watery aqueous portion of the tear film is produced by that gland. So if it is not being produced, then it will ultimately cause dry eye. Okay. Next disease that we will be discussing is dry eye itself. It is also known as Keratoconjunctivitis, sicca. These are some of the pictures that you can see of dry eye. Next, introduction. Keratoconjunctivitis sicca is a condition that is commonly referred to as dry eye. The medical term means, I told you, itis means inflammation will be there. Inflammation of cornea and surrounding tissue from drying. It is a common eye condition resulting from inadequate production of the aqueous portion of the tear film by the lacrimal gland and or gland of the third eyelid. I told you, third eyelid is responsible for 50% of the production of this aqueous portion of the tear film. When this is not being produced, dry eye is happening. So either the production is inadequate from the lacrimal gland or from the third eyelid, gland of the third eyelid. So this is causing dry eye. Now, causes. Tears are required to lubricate the cornea and remove any debris or infectious agent that is there in the cornea and that may contact the eye. The tear film is a mixture of what? Mucus, fatty acid and mucus, fatty liquid and water. Now, any condition that impairs the ability to produce adequate amounts of tear film can result in dry eye. Some of the common causes of KCS include immune-mediated diseases, that can damage the tear production mechanism or producing glands. That can cause dry eye, or systemic diseases like, for example, canine distemper may cause a dry eye. Apart from that, medications like sulfa drugs may cause that, hypothyroidism may cause, or nervous symptoms, effects of an inner eye infection like neurogenic KCS it is called. So it may also cause dry eye. Next, breed susceptibility. The breeds that are susceptible are American Cocker Spaniel, Bloodhound, Boston Terrier, English Bulldog, Lhasa Apso, Pug, Shih Tzu, Yorkshire Terrier and all these breeds. Clinical signs. The most dogs have painful red and irritated eyes. They often blink, squirt and hold the eyes shut because they are having dry eye, it's getting more dry if they are opening the eyes. There is often a thick yellowish mucus discharge present as a result of the decrease in aqueous component of the tear film. When there is production of tears properly, then it will not be mucus or yellowish or thick. It will be watery discharge. But here, proper tear production is not happening. So it is thick, it is mucoid, it is yellowish in color. So this is a very common symptom of Keratoconjunctivitis sicca. Corneal ulceration is often present. Vision may be reduced if scarring is extensive. Many dogs will develop corneal scarring called hyperpigmentation. Hyperpigmentation that can be seen on close observation. Corneal scarring often looks like a dark film covering the eyes. I showed you the picture like this. You can see scarring of the eye, scarring of the eye. Okay, happening. Okay. Now, tiny blood vessels coursing across the cornea, that is also known as neovascularization. New blood vessels, teeny blood vessels can be seen. Vision may be reduced if scarring is extensive. The eyes often have a dull, lustreless. The water is not present. The aqueous portion is not present. So it will be lustreless appearance due to corneal drying. Caseous most commonly affects middle-aged to older dogs. Both eyes are usually affected, although one eye may appear worse than the other eye. Okay, mostly both the eyes will be affected. Diagnosis. This has a very clear-cut diagnosis with the help of tear production test that is known as Schirmer tear test. This simple test uses a special wicking paper to measure the amount of the tear film produced in 1 minute. Okay, so you will be using that wicking paper here, and it will be showing the amount of tear film being produced in 1 minute. Okay, additional diagnostic tests may be measuring of intraocular pressure to check whether glaucoma is present or not. Then tear duct examination may be done to ensure normal tear drainage. These are the main diagnostic procedures. Apart from that, history, clinical signs are always being taken to diagnose any case. So this is what is the test I was talking about. This tear production test or Schirmer tear test is this test. You can see here only this much tear is being produced in 1 minute, and here you can see. Okay, so it is helpful in determining or diagnosing this particular problem in dogs. Next, the treatment of the dry eye has two objectives: to stimulate tear production and to replace the tear film, thereby protecting the cornea. So one is obviously to stimulate the tear production because it is getting dry, so we need to stimulate the tear production. And the second thing is to replace the tear film, thereby protecting the cornea. There are two commonly used ophthalmic medications to stimulate tear production. One is cyclosporine, that is very commonly used, and tacrolimus. Both are easily placed in the eye once or twice daily. These are very safe to use and also dramatically improve the situation with their persistent use. Apart from that, pilocarpine is used when there is neurogenic cases. Neurogenic cases, it happens when there is some ear infection too, There is nervous system effects of an inner ear infection that is called neurogenic cases. Okay, so when there is neurogenic cases, then pilocarpine is used. Okay, tear film replacement is often done. This is critical to keep the cornea moist and healthy, especially during the initial phase of treatment. Apart from that, topical antibiotics may be required, or topical anti-inflammatory medications may be required to treat the underlying infection and inflammation. Apart from that, gently cleaning the eyes several times a day with a warm, wet washcloth will help your dog to feel better, because obviously it is dry. So if you're giving something moist, in a frequent interval, then it will be very soothing to the eyes of the dog, and it will also help stimulate tear film production. all these 5 diseases are now complete, I'll be discussing some very important general healthy eye care tips with you to keep a healthy eye of your dog. So look into their eyes quite often. It is a good idea to take a close look at your dog's eyes regularly. If there is any changes like redness is there, cloudiness is there, or tearing is there, you should immediately go to the vet. Then schedule routine checkups. It is always very important to schedule routine checkups of your dogs. Vet will be seeing their eyes, they will be seeing any abnormality in the eyes, and then they will be taking prompt actions so it does not go to a very high level of danger to the eyes. Then clean them gently. When you give your dog a bath, you can use a cotton ball or soft cloth to gently clean around the eyes. Wipe outward. I am giving you the total process how you should clean the eyes. You should not be harsh to the eyes. Obviously, it is a very sensitive organ. Wipe outward from the corner and be careful not to scratch the eye. You should not be scratching the eye. What you should be doing is you should be wiping very softly, okay, from the corner, and be careful not to scratch the eye. If your dog has tear staining, which causes dark spotting in the fur around the eyes, you may need to clean them more often. So when there is staining, like it is blackish in color, you need to clean it more often because this stain is happening because of the tear production. Clip their nails. Their nails should always be clipped. Clipped means cutting the nails. They should be clipped because they may, damage their own eyes. But they have to clip their nails in frequent intervals. If you are not able to do it, go to a groomer or a vet. They will be able to do it more properly. Trim their hair. Their hair should be trimmed, especially around the eyes. Those dogs having bigger ears, they should be trimmed. When you groom your dog, make sure the fur near the eyes isn't so long that it irritates them. When our eyes are covered with hair, you are seeing I'm doing like this very often. Why? Because the hair is coming to my eyes and it is disturbing me. So similarly, it disturbs them as well. So you need to groom them properly and remove or cut the hairs around their eyes or the furs around their eyes that fusses them. Close windows when driving. This is a very important thing. I have seen in many cases when owners are taking their dogs in the car and the dog is keeping its head out like this. It is going to damage his eyes because some dust particles or dirt may come and it may damage your dog's eyes. So you should not be doing that. It's simply not safe. You should also close your windows when your dog is in the car. Your dog might love that thing, but he's not understanding. It might be harmful to the dog. Bugs, dirt, or other debris could fly in through the open window and harm your dog's eyes. When we are going like in a bike or something, we are riding the bike, we are the driver, things come into our eyes as well, but we have a helmet, they don't have. So you have to close the windows and not let them keep their head outside the window so that they have a good healthy eye. So these are some of the points you have to follow to have a good healthy dog with a healthy eye. Okay, so this is the end to our video today. Hopefully you liked our video, and please do like this video and subscribe to my channel. Thank you so much guys. Thanks for watching, and please be safe guys. This is a very hard time for we people here, and stay safe. Keep good health. Wishing for all your good health. And okay guys, bye bye. See you in my next video. Please do wait for my next video. Bye bye. Take care.